Mental health in Black communities is a topic that's often not talked about, dismissed, and it's often portrayed as a white people's problem or a white people's issue. It just completely doesn't exist, and when it's acknowledged in our communities, it's often seen as personal weaknesses. For some, it could be lack of faith, or even in some cases, there's links between mental health and witchcraft, or let's say bad luck. Um, the fact that people don't talk about mental health is destructive to our communities because you have people who are dealing with their struggles alone, who feel ashamed to talk about their own struggles, and there's no places in our community where we can all come together and discuss about these things openly without the shame, without the stigma. 2 years ago, I dealt with depersonalization realization, which I didn't know at the time what it was. It's sort of a disconnection from one's person or one's reality. And dealing with that was my first experience with mental health. And I didn't know exactly what I was going through because, first of all, it wasn't something that was well known. I guess it's not something that's well known as depression or schizophrenia or bipolar disease. So it was something that was totally new to me, and I couldn't really make sense of what was happening to me. Plus, mental health in my community, I'm from Rwanda, is something that's still really, really taboo. People who are living with mental illness are often described as crazy, or they're just, lost people, or people describe them as, you know, someone put a spell on that person. So it was really hard for me to understand what I was going through, and there was no space in my community where I could openly talk. Where I could openly talk about the topic. Even in my own family, I didn't know how it would be received or perceived by my parents or relatives. Plus, I come from a very, very religious family, so the intersection between religion and mental health is also a tricky one. For some people, religion or faith or spirituality is a source of healing, but in other cases, it's also um, something that can prevent people from looking for alternative kind of help. In my case, it was both. And I think it's important that we look at different alternatives, ways to deal with mental illness in our communities, but that we first acknowledge that is something that's affecting us and that is present. Um, so what happens the most, I would say, from my experience and from a conversation I had with people in the community, is that um, there's always this stage of this male. So mental health is just dismissed, or we deny that we're going through something because we don't understand what's going on, or we understand it and then we feel ashamed from it. And I think for me, the most important thing was acknowledging that the condition was there in order to heal, because you can't fight something or you can't get over something that you don't even acknowledge as real. Um, another thing, another struggle I would say that I went through was that of overcoming the strong black woman trope, which is often imposed on us black women. So we're often thought that we are strong, black, independent women, and that we can overcome whatever comes our way, and that we don't need anyone's help, especially not men's help. And I mean, I know a lot of strong black women in our communities, my mother being one, and obviously we're strong. Obviously, most of us are independent, or we can be independent. But I think that the problem comes when we're not allowed to be anything else but strong. That's when the problem arises, is that when we're not allowed to be anything else but strong in our identity, and then when we're faced with mental illnesses or a mental condition, uh, then we perceive it as weakness because being strong is the only option, or is the only thing that we're allowed to be. So I think it's really important that we teach our daughters, sisters from a very young age, that it is okay to be vulnerable and to be strong at the same time. We are both. And I think that imposing this image of the strong Black independent woman uh, is something that is affecting us, but that could also heal us in a way. But I think it's important to acknowledge that we are both strong and vulnerable, and to let ourselves be vulnerable, and to let people come to us, reach to us, and accept help that comes our way. And in terms of accepting help or reaching out to people, I think that it's really important that as a community, we first acknowledge, like I said, the current issue that is mental illness in our communities, and that we create spaces for such conversation to occur, and that we also provide services to our community. And I would say also that something that I've learned throughout my journey was that reaching out is important, and accepting and receiving help is also important. But I think that it's also important to respect people's boundaries, uh, and time and space. Um, I remember reaching out to only one person 2 years ago. It was my sister, because that's the only person with which I felt I could be vulnerable. So I think it's really important to not also impose our help, or impose treatment, or impose anything on anyone that's not ready to accept it, and to really to provide help, to provide services, to let people know that they're there, and to let them um, reach to that help whenever they feel comfortable to. Um, and creating spaces is something that's just vital for us. We need to come together and talk about these things, because people are suffering in silences. Um, Another thing I would say is also realizing the importance of self-care. Um, Often there's this um, there's this tendency of seeing mental health as a biomedical issue only. I mean, obviously there's something biomedical that's happening in our brain when we talk about mental conditions, but often the solution to mental illness um, is often seen as either biomedical, or taking treatments, taking pills, going to therapy. But I think it's important to also look into alternative means treating mental health, such as community, coming together, just talking with other people who've lived common experiences, is something that can provide healing to people, and I've seen it happen. Or just looking into self-care, self-introspection, meditation, or looking at alternative ways to treat mental health is something that's very important. Being aware of oneself, being aware of one's thoughts and thought processes is also something that I learned along the way that was very helpful, because depending on the condition, depending on what people are going through, I think there is a power within each and one of us that can allow us to heal if we only look into ourselves. And obviously, for some people, medication is going to be the solution. For some people, therapy is going to be the solution. For some people, community is going to be the solution. For some people, church is going to be the solution. Faith is going to be the solution. Whatever it is, find what's best from you. Try different things, and go out and don't think that mental illnesses or conditions are a one-fit-all type of solution, and medication is not always the solution for everyone, but it can also be. So I think it's important to realize that there's different ways to overcome them. There's different ways to travel your journey, and that there's no one-size-fit-all model that should be followed. Um, Mental health in Black communities, like I said, it's something that we don't talk about. But I think it's also important to recognize the social determinants of health in our communities. Um, I've tried to look for stats in Canada about Black mental health, but it was something that was really hard to do because in Canada there's often this discourse of multiculturalism. Racism does not exist, race does not exist. So looking at stats for Black mental health was really hard in Canada as opposed to the US or to the UK, where these kind of data are being collected on the regular. And looking at stats from the US and from the UK as well, they were similar stats. You could see that African American adults were 28% more likely to develop a mental condition compared to the whites. And that was due to a lot of different social determinants of health, such as poverty, homelessness, increased exposure to violence. So I think it's important that as a community we also look at what is affecting our mental health, the conditions in which we live in, the external factors that affect our mental health, such as racism, systemic oppression, discrimination, even housing, housing, and looking at how all of these things affect our mental health and pushing for changes in our communities surrounding us, looking for structural changes also in this society, and looking at ways in which we could increase access to service or increase access to services in our communities, and also making sure that we have people from our communities who are health caregiver, because another issue is also people don't feel comfortable going to therapy and discussing about their own struggles, which might include racism, to, let's say, a white therapist. How do you talk about your own oppression or own struggle as a Black person to someone who's part of the dominant group that's oppressing you? So another problem is also the lack of people from our communities who are health caregivers. So I think it's important that as a community we make these people available, linking other people to other people. And so for some people, that's not an issue. Any health caregiver works. But for some people, I know that it's really important that they have someone to who they can relate, to feel comfortable in their care. And I think it's important that we are aware of these people and that we are aware of health caregivers in our communities that are available to provide these services to us. Last January, we organized an event on Black mental health and self-care in Montreal. We were a team of approximately 10 students, mostly students. The event was held at McGill University, and we all came together because mental health obviously was something that was really close to us, and we all had experience with it, or had people who had experience with mental health in our communities, and we saw that it was something that was really important, so we had to come together and make this event. And more than 200 people showed up, to our surprise. I mean, we knew that it was something that people wanted to talk about, but that they didn't get the chance to do. But I never thought that we would gather 200 people in one room. And that night was just magical. You could feel the energy in the room, and you could feel that it was something that has been on people's mind, and that it was something that people wanted to talk about. And looking at those 200 people and how well the night went really confirm the fact that we as a community really need to come together to talk about these issues. And people are willing to talk about these issues. People are willing to come and sit and wait and hear about other people's stories and heal together. So I think that event was the manifestation of the need for such conversation in our communities, and hopefully we can make other events in the future, or hopefully other people can also make other events, and basically just follow up the discussion that we had back in January. Basically, the night was divided in three sections, I believe. We started off talking about the perception of mental health in our communities and how we as a community perceive mental health. And then we moved on to the social factors, social determinants of health that affect mental health. So talking about racism, systemic oppression, and then barriers to access to healthcare. So talking about the differences between, mental health for Black women, mental health for men, looking at how these two groups see or experience mental conditions differently. We then looked also at gendered violence in our community and how that also had a huge impact on mental health. And then I believe we ended with talking about self-care, the importance of self-care, and the importance also of having people of color as health caregivers in our communities. So hopefully, like I said, hopefully there's going to be more event in the future, and hopefully we can pursue this conversation on mental health in our communities, because too many people are suffering in silences. Too many people are suffering in silences for basically nothing, because if these things were acknowledged, it would be so much easier for us.